Right. Hi again. So, as we were
Hi.
discussing earlier, that you decided that, okay, fine, you would like to continue and pursue or, advance your career ahead in USA, है ना? So, like,
Mhm.
you started gathering all the information about it. So, can you just tell our, candidates and aspirants we have that how many steps do we have exactly in our in this USMLE?
So when I gave the exam, it was very different versus now because of COVID. A lot of things have changed.
Mm-hmm.
When I took the exam, there were 3 steps, and step 2 was divided into 2. So there was step 1, step 2 CS, which is clinical skills, step 2 CK, which was clinical knowledge, and then step 3.
Taken.
Right now, sorry, ma'am.
No, no, yeah, good.
Okay. Yeah, and then now I think they have changed it quite a bit because of COVID and because a lot of people, we couldn't like be in contact with each other. So they changed it to step 1,
Mhm.
step 2, and then a step 3 exam. Step 1 is now only pass fail,
Okay.
and step 2 is also just pass fail. Step 3 is your scored exam now. When I was taking them, all of the exams were scored.
ओके सो बेसिकली अगर अगर हम उस वक्त की बात करें कंपेयर टू द टाइम वी हैव नाउ सो हाउ मेनी स्टेप्स अ स्टूडेंट कैन गिव इन होम कंट्री और द the country they are studying medicine right now, or they have to compulsorily to give these steps in USA only.
So ideally, when I was taking the exam, it was different, but I'm going to talk about what's happening right now because all of our students and our audience is right now. So right now you can take step 1
Mm-hmm.
in your home country or
Okay.
wherever you're studying or all of those things. Step 2, in my opinion, you should come and give it in the US.
Mm-hmm.
I think you're still able to give it home country, but it's best because the proctors, which means the people, proctor is the word for supervisor during the exam in the US, is more versed in American medical system versus a proctor who's in India or who's in Russia or who's in any other country. So I
Mm-hmm.
would hope and I would recommend doing a step 2 exam in the US. Of
Mm-hmm.
course, it comes with its own financial concerns and all of those things. But yeah, step 2 and step 3, ideally, you should do in the US.
So how to actually begin to apply for this basically?
Yeah. So the for all foreign graduates in the US, so there is like 2 groups of people.
ठीक
There
है.
are IMGs, which are international medical graduates, and US graduates. These are the 2 set of groups.
Mm-hmm.
US graduates take their step 1 and step 2 while they are in med school.
Okay.
So during their 4 years of medical school, they take that exam.
ठीक
For
है.
you and me and for all IMGs, international medical graduates, you are welcome to take that exam during your medical school as well. But
Okay.
that involves
Okay.
extra studying to the point that you're studying for your own medical school exams,
Mm-hmm.
plus you're studying for USMLE.
USMLE.
So you are permitted to take the step 1 exam after you have done first 2 years of medical school, which is basic clinicals,
Okay.
which is basic sciences studies, excuse me. So which includes your microbiology, your anatomy, your physiology, your histology, biochemistry, all of those things, right? Your basic sciences. You're welcome to take the step 1 exam after that, after you have completed those courses.
Mm-hmm.
Step 2 exam you're able to take after you have completed clinicals, which means you have like gone to the hospital, taken a history, done a physical exam, made your assessments, written your own plan, and things like that.
Mm-hmm.
Because the step 2 exam also involves actually taking a history and physical history, doing a physical exam, and writing a full note, which
Okay.
is like the American style of writing.
Okay.
So understanding all of that is best done in the US.
Okay. So, जैसे I mean, usually for foreign medical graduates, it's a 6-year course, right? So let's say like after the third year, they can apply for first step, I guess.
They can take the first step.
They
They
can.
should apply for this. They should apply when they are in their second year.
Okay.
Everything in the US happens a year before. So if you're starting in August of next year, you have to start applying August of this year.
Oh, okay.
Because
And
there is only certain exam dates and a certain eligible criteria that you have to meet.
okay, and they can check all this. Is there like any particular website, I mean, US government is providing?
Yes, so ECFMG is the universal governing body for all international medical graduates in the US,
Okay.
irrespective of which country you're coming from.
Okay.
ECFMG also has a directory of world medical schools that it recognizes.
Okay.
You are able to apply
Mm-hmm.
for that ECFMG only and only if your university is included in the list of world medical graduates. If
Okay.
your university is not included in their list, then you are not eligible to apply in the US.
Oh, okay. That is also like that.
So all of this comes, yeah. So it's all based on before you start medical school. If you want to study in the US, you
Yes.
have to try and get into a foreign medical school, which is recognized by the World Medical Directory.
Oh, okay. And do they need any some sort of particulars, basic documents from the academy, from their university to apply over here? If you can list some.
Yes. Yeah, it's very, very important. All of those things are very, very important
Mm-hmm.
because it's hard because America only takes documents which are in English.
Mm-hmm.
So, if you are in a foreign country and your medical school transcripts, which is your first and second year transcripts, which means all your courses, all the courses that you have done and what grades that you have got, and
Mm-hmm.
then that document from your dean office saying that you have successfully finished all the clinic basic sciences courses. All
Mm-hmm.
of this comes from your university. Ideally, it has to have the dean's signature. It has to have the like I think the department head signatures.
Mm-hmm.
And then you need to get it translated with an official translation agency
Mm-hmm.
and also notarized.
Notarized.
Once it is notarized, your dean has to also sign the notarized copy again, and then you have to go to the city department or the state department to get it apostilled.
Okay. And after that, you need to
So,
just apply through the soft copies of it. You need to upload them in ECFMG website, right? In your account.
so ECFM will only take documents that your dean's office uploads. You cannot personally upload any document on there,
Okay.
which is the harder part because that's why it's best that you do all of this when you're in medical school.
Medical school, right.
Because once you go back to your home country,
Mhm.
trying to connect with someone in your dean office, they're never going to answer your phone. We know how administration offices work. They
Uh-huh.
don't answer your phone. They're like, oh, this is work and extra and extra. So either having a friend back in your medical school or being in medical school while you're doing all of this is very, very helpful.
Okay. So this is just for step one, or it's applicable for all the steps they are going to give?
So it's important for step 1 and step 2.
Okay. So like agar
By that time,
mhm.
So by that time, you have already finished your basic sciences and your clinical sciences.
Okay.
For step 3, you only need your graduation diploma.
Degree.
In
Okay.
addition to what you have done before, you only need your graduation diploma.
Okay. And any tentative idea, like kuch approximate idea that how much fees, I mean, they are taking these days for the application?
Um, so the applications are expensive.
Okay.
For American students, it's only the exam money that they have to pay. But for foreign grads or international medical graduates, you also have to pay ECFMG fees.
Hmm.
Let me quickly look it up. I think it's quite a bit, but let's see the fees overview. So yeah, okay, it's not crazy. So application fee for ECFMG, the
Mm-hmm.
starting the online application system is $160, 160. Step 1 application fee is $1,000 if you're taking it if you're applying from the US and taking it in the US.
Mm-hmm.
And if you're taking the exam outside the US, it's $1,000 plus $200, the surcharge that they do.
Okay.
Same way with the step 2 exam.
Mm-hmm.
It's $1,000 if you're taking it in the US
Mm-hmm.
and $200 extra if you're taking it outside the US. And if you change your testing region, or if you change your if you extend your eligibility period for the exam, it's another $200.
Okay, so is there any like are there any extension kind of options are there? Like suppose the date you have chosen like a year back, and suddenly you realize like okay
Yeah.
fine I won't be able to take care on that date. So is there any option that they can change the dates and location?
Yeah, you can definitely change the date and locations, but it again comes with a cost. Each change and each extension period is about $200.
Okay. So, you started, as you said, like you have already had this in your head, like, okay, you will be going to US. So you started preparing for it in your medical school itself?
No. So I knew that I wanted to go to the US and continue studying here, but I have, like I said, I did not have the financial
Mhm.
stability to like make these $1,000 application is around
Mhm.
70,000 rupees, right?
Right.
Like it's expensive. And
Yes.
then in addition to all the $100 translation money and like courier money. So what I decided is what I'm going to do is I'm going to bring myself to the country. I'm going to bring
Okay.
myself to the US. So I applied for a master's in public health and I
Mm-hmm.
got a full scholarship for master's in public health.
Mm-hmm.
So I came and did my master's in public health at the University of California, San Francisco.
Okay. Wow.
And while I was doing this, I picked up a campus job of a research assistant.
Uh-huh.
And then I was getting paid campus money. And
Okay.
with that campus money, I applied for my USMLE steps. And I also had enough money to get the translations done, get apply for ECFMG and apply for USMLE. So all of that money came from my research assistance money because my course, my master's was completely scholarship based.
Scholarship.
So I did not have to take any loan or I did not have to ask my parents for any money.
That's quite
So that worked out.
inspiring. Yeah, that's quite inspiring, Diksha, actually. Why? I'll tell you, because, there are, we all know, like, we are FMGs, we are, the education is being funded by our parents. Most of us, they come on
Yeah,
loan during undergraduate. So, we do have this dream to go to US and practice over there. But then again, there are some boundaries, there are some limitations, and one of them is finance. So, I mean, the
yeah,
path you chose, I mean, you financed your journey, you financed this everything. I mean, for yourself, it is quite appreciable. And I think it will inspire many of the students who are thinking that,
yeah,
finance is one of the major obstacle they have. Right.
very big.
So it's really appreciating, I would say. So, getting back to my question, so you started preparing it like after coming back to India. I mean, once you had finished your graduation, then you came back to India and
Yeah.
then you started preparing. So, can you give some glance about the study material you and the strategy you had?
Yeah. So like when we all come back from India, it was also very important for me to have an Indian license. It was
Uh-huh.
in my head. Like if I want to do it, I want to do it everything 100%. So
Okay.
I wanted to do the Indian license. So like all of us, I did go to Delhi. I did, study for that exam. I took that exam. I passed it. But while I was preparing for that exam, I was also preparing for my USMLE.
Okay.
So ideally, it's very hard because Indian medical exams are very different from most other country medical exams.
And
Indian
let's
medical
not,
exam is like one.
yeah, and let's not forget the environment of Gautam Nagar.
Yes, yeah, it's not helpful. It's not
Yes,
helpful at all. It's not a study environment. It's stressful. It's annoying. So
yes,
it's not study environment at all. But when you're studying for the foreign medical graduate exam in India,
right.
so the medicine is the same. You have to remember the medicine is the same. The medicine does not change.
Mm-hmm.
Medicine all over the world remains the same.
Mm-hmm.
The test taking patterns are different,
Yes.
right? So remembering that is very important. Remembering your medicine. The biochemistry does not change. Biochemistry is the same all over the world,
Yes.
right? So
Mm-hmm.
remembering that. So I start when I was doing my studying for my foreign medical graduate exam in India.
Uh-huh.
I bought the first aid for USMLE step 1. It's a
Okay.
basic, it's the most basic book that you can start with. And that's not enough. It's not the one book that you have to do. You have to do many, many studies, many questions. You have to do around 3 or 4,000 questions to actually crack the exam.
Mm-hmm.
But the first aid for the USMLE one is very basic understanding of what the exam will have, and like small knickknacks, small questions, making your own flashcards, putting down keywords and putting down key answers. So that's helpful. Again, medicine remains the same, just the exam pattern changes. So understanding what the exam pattern was. In India, it's like multiple choice question, one answer is right, 3 are wrong. In the US, all medical exams have 4 options. All 4 are correct, but which is the most correct? That becomes hard, right? All antibiotics in an option are correct. All antibiotics are Pseudomonas sensitive, but one is a single best answer given the patient scenario.
Right.
So that part is different. So starting with first aid for the USMLE step 1 is the best thing when you're trying to study for another exam as well. If you're not trying to study for another exam, you can, in association with first aid for the USMLE, you can have adjunct study material. And there is a lot of study material out there, but I would suggest UWorld. Now, again, this is where the expense comes in. UWorld is a question bank of more than 2,400 questions, exam style questions, but it's almost $790 or $800.
Oh, okay.
So that is expensive as well. That's also very expensive. So having some form of finances, if you're in India and you're earning, like you're like, I'm not sure what it's called anymore, but like you're a house officer, if you're earning a certain basic salary or during your internship, you're earning some money, try and save up all of that, like save it, try and cut costs, try and save money, and just like try and fund your own things. So UWorld is a great question bank. In addition to that, there are a lot of question banks online, which are also free. But having the first aid for the USMLE step 1 and UWorld question bank is the 2 most important and most crucial study material, in addition to other adjuncts that are available online. I would start with that. The USMLE website also has mock tests, which are free. So taking those mock tests, which are called NEMB exams, so National Boards of Medical Education exams, which are like long question banks, and you are able to like find those online and take those and try and get your score. Once you get your score, the score of the NBME exams actually correlates with your USMLE exam score. So you need a passing of 196 or more. And again, it's still a pass fail, but your pass cutoff is 196.
196. So
196 out of 2.
सो लाइक आपको स्टेप 1 से लेवल अप करने के लिए स्टेप 2 के लिए लेवल अप करने के लिए पहुंचने के लिए यू नीड टू हैव एटलीस्ट दिस मच स्कोर अदरवाइज इट वोंट वर्क इट विल नॉट वर्क
It won't.
एंड सपोज लाइक मुझे एक पर्टिकुलर स्कोर आता है लेकिन मेरा एक आध नंबर कम हो गया उससे तो व्हेन आई कैन रीअपियर फॉर द स्टेप 1
You can reappear in the next week, but you have to remember, very next week, but you have to remember the USMLE scores are in your profile for the rest of your life.
Oh.
So if you fail a USMLE test, it will be on your scorecard forever.
Okay.
So it will always say USMLE step 1, the first attempt failed, second attempt passed.
Okay. So does it have any
And that
later?
It has a huge impact. It has a huge impact on your residency application and the residency matching, because most programs just filter out.
Okay.
You have to, the thing to remember is, firstly, we are foreign grads. And secondly, if you have a low score and you have an attempt, you're filtered out. Nobody wants somebody whose clinical knowledge is not good.
Right. Right.
Right? जैसे एग्जाम्पल देते हैं, जब आप इंडिया में हैं और 12th की एग्जाम दे रहे हैं, 12th में कुछ लोगों को 86% आते हैं 12th बोर्ड्स में, और कुछ लोगों को 56% आते हैं, और ये दोनों लोग एक सिंपल जॉब के लिए अप्लाई कर रहे हैं, दोनों पास हैं, दोनों 12th स्टैंडर्ड पास है, बट जो जॉब एप्लीकेशन देख रहा है वो किसको लेगा, 86% वाले को या 56% वाले को?
Yeah, that will matter.
That will matter, right? So when you're taking these exams, you have to remember, our biggest red flag is that we are a foreign grad. So you have to be above every other American graduate, just above them. So
Uh-huh.
जब आप exam लेते हैं, you have to not give it for the sake of passing. You have to give it for the sake of getting an excellent score.
Yeah, from your this point, one really interesting question came in my like into my head right now. If is there like when is there any difference when a foreign medical graduate, like in our terms, in our terminology, when a foreign medical graduate appears for this exam, or when an Indian medical graduate is appearing for the exam, there any difference at that time?
So you mean foreign grad and Indian grad?
Yes, I mean the Indian medical students who are studying abroad and the Indian medical students who are studying in Indian medical colleges. So, is there any difference while they are appearing for USMLE or for the
So you
matching?
have to think
Yeah,
this. USMLE is a US based
yes,
exam. For
okay.
them, everybody else in the country is a foreign grad.
Foreign medical. Okay,
तुम इंडिया से हो, तुम दुबई से हो, तुम गुजरात से हो, तुम इन
right,
पाकिस्तान से हो, everybody else is foreign.
right.
When you are applying for this exam for USMLE,
Uh-huh.
if you're not a US grad, you are a foreign grad.
Foreign
तो
grad.
फर्क नहीं पड़ता आपने कहाँ से करा है,
Uh,
आपका स्कोर मैटर करता है.
So that's a good thing for, I think, for the foreign medical graduates. Stop, just demeaning yourself and thoda underconfident hona band karo. Once you will just appear in the exam, you're passing the exam. You are, there is no difference. The students who are studying in India or Indian students who are studying abroad. So that's a very good thing.
Exactly.
Right. So, coming to like, back to our topic, like the preparation. So, one more question, interesting question I would like to ask you, which is while you were studying in your medical school, uh, मतलब उस जो यूनिवर्सिटी में आपकी पढ़ाई होती थी, आपको जो प्रैक्टिस, आपको जो क्लिनिकल एक्सपोजर आपको मिलता था, did it help you to prepare for USMLE or for that's like for any licensing exam, let's say?
Classroom knowledge, yes. Clinical knowledge, no.
Okay.
So classroom knowledge, I mean, like I said, biochemistry is the same everywhere,
Mm-hmm.
right? Anatomy is the same everywhere. Clinical knowledge, yes, asking questions, understanding, making your differential diagnoses, parsing out your differential diagnoses.
Yes.
It's very different. I think I would say I learned that more while working in the US medical system.
ठीक है.
Because most countries do things very differently, right?
Uh-huh.
For example, when we were in medical school, we were going in the wards in third year and fourth year. We were doing everything. We were asking questions, we were taking a history or doing a physical exam. All of that is great.
Yeah.
But like, how many times did you and I come up with a diagnosis or come up with an interesting diagnosis?
Yeah.
Most people had diabetes, blood pressure, heart disease, that's it.
Yes. Right.
Right?
Mm-hmm.
But the US medical system is very different. I see so many interesting cases that I had not even heard about them in medical school.
Mm-hmm. So like
So
ठीक है.
it's a lot of
Right.
self-driven.
राइट सो लाइक आपकी जो मेडिकल स्कूल की जो आपकी नॉलेज है वो आप थियोरिटिकली आप उसको वहां पे आप उसको स्ट्रॉन्ग कर सकते हो है ना सो दैट इज
Yes,
व्हाई यू अर्लियर सजेस्टेड कि भाई जो प्रैक्टिकल एग्जाम है इट्स ऑलवेज बेटर टू कम टू यूएस एंड देन गिव है ना ओके
exactly.
Okay. So tell me one thing. Now the student has suppose cleared his or hers, step one. Now for the step two, suppose
Mhm.
the person is, the candidate is willing to, go to the US. So what kind of visa requirement they have, if you can just guide us about it.
So, visa requirement for taking the exam is just a visitor visa, B1, B2.
ठीक है. तो वो कितने time
If you're
duration?
planning to come here on research, if you get a research position, if you're applying for a research position, your home institution in the US has to sponsor a J1 research visa.
Okay. And what is the difference between both of them, if you can just explain a bit?
So a B1, B2 visa is a visitor visa. So basically you come on a tourist visa to you can take the exam, but you can't work here, you can't be in a hospital, you can't be in a research institution whatsoever.
Okay.
J1 research, which very few people get, is a visa where you are sitting in India and applying for a research assistantship. And if you get the research assistantship, you will be in a medical system. You will be doing research under some training. Very, very poor. People don't know what a randomized control trial is. People don't know what data collection is. People don't know what the difference between cohort studies and case control studies. You don't know. Nobody teaches people this in India or in any other country. It's all about clinical, 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 clinical. India is also, India and most other countries are symptom-based medicine. Right? If somebody has a cough, runny nose, people will give them a cough, runny nose medicine. In the US, it's evidence-based medicine. Cough, runny nose is not basic sardi. Cough, runny nose for more than 14 days, by definition, by evidence, is sinusitis. So you treat them with augmentin for 14 days versus some random cough syrup, right? So it's very different. Symptom-based evidence, symptom-based medicine versus evidence-based medicine. And that's why research is so highly valued in the US.
Okay. So even for step 2, they will need the documents from the individual's respective university and academy, if I'm not wrong. Yes?
Yes. Yes.
Right. Right. And they can apply from the home country, and they can apply
Yeah.
from the country they are studying in as well.
Yes. Yes, they can.
They can do it.
Step 1, step 2, both you can apply from your home country. In addition to $1,000, you have to pay $200 more to take it in your home country.
Okay, okay, that's great. Now tell me one thing, Diksha, that is there any kind of, are there any kind of some, clinical rotations or observerships, which could help a candidate to, go through, which can make it easier for them? या फिर उनका प्रोफाइल जो है थोड़ा एडवांस कर सकता है? Are there any such things over there?
Yeah, 100%. And most foreign graduates need those. Nobody, no residency in the US will take a foreign graduate who has zero experience in the US. There
Okay.
are no candidates like that. You have to come here, you have to do externships if you get, which is very hard to get. You have to do observerships, which you may get, but again, it's the most, some of the hospitals now have paid observerships where you can like pay the hospital to come and be an observer. You can't touch the patient, you can't type notes, you have no medical license, you have no malpractice insurance, so they will not let you touch the patient. You will only have observerships, and you will have externships if you may get them.
Okay.
Clinical rotations are very, very hard to get for foreign grads because the problem is you are not covered by malpractice insurance.
Okay.
So if you make a mistake with a patient, the hospital will be in a very, very bad situation, and they don't want that kind of liability.
Okay. So the observership must be, they need to get it in US itself. It's not like that observership, what you're doing in your home country or anywhere else is not, count. They don't count that, right?
No, they don't, because it's not what the goal is, that they want people who are going to work in the US. So
Okay.
how they have worked in your home country, it doesn't matter to them.
It doesn't matter to them. No matter like how much experience you are gathering, it's like from in US, you are starting from zero.
You are starting from zero.
From zero. And how can like a candidate can apply for such observership? Do they always need, directly they can apply, or they need some consultancies, or they need some sort of, seniors guidance, or what is the path exactly to go get into it?
So it's a very good question. It's two very different things, right? There are many consultancy services or consultancy, I don't know, groups or like companies in the US who like do this as a business.
Right.
But you can also, as an applicant, cold emailing. I'm not sure a lot of people know what cold emailing is. Cold emailing is like sending 100 emails every day to different hospitals requesting for observerships. Like literally send out very personalized emails every single day. You just cold email everyone and somebody will respond.
Okay.
Like someone will respond
And
with that hope. This is
what about like
straight cold emailing.
if somebody wants like 110% positive result, what should they do like to get into this observership or clinical rotation?
There Of course, if you have the money, you're welcome, they are welcome to pay for it.
Oh, okay.
Right? But
Uh-huh.
paid observerships are not, yeah. Paid observerships are expensive. $1,500 for a month.
Uh-huh.
It's too much.
It's too much, right? अच्छा, तो इसके for
It is
observership
too much.
also, they need a J1 visa, if I'm not wrong, right?
For observerships, if you're not touching a patient, you need the visitor visa,
अच्छा,
B1, B2. If
okay.
J1 is only for research, if you get a research assistant position.
Okay. And the second option is that they can get into some, research courses or something, and then side by side they can, just give their steps and then get into observership and the thing. But I don't think that is also easy. I mean, getting into any
That's
such
not.
courses, that getting into such courses is one, they are very expensive, they are very difficult also. Second, if you want to get the scholarship, I don't think it is easy. It's like you have to be very unique, you need to have a very unique profile and quite advanced profile, right?
Yeah, it's very hard. Masters here is not easy. Like doing masters here, your GPA has to be spot on.
Mm-hmm.
So GPA is your grade point average,
Mm-hmm.
which is like your graduation percentile if you compare it with Indian scoring system.
Mm-hmm.
So GPA is out of,
Mm-hmm.
right?
Mm-hmm.
When I did my master's was 2 years,
Mm-hmm.
but in my second year, I matched into residency. So, but
Okay.
I did not want to do my master's halfway.
Okay.
So I extended my master's from 2 years to 3 years.
Uh-huh.
I did my last year of master's with my first year of residency.
Okay.
So I did both things. I did my first year of residency, which I worked almost 70 hours a week, plus
Uh-huh.
my master's at the same time, still maintaining, so GPA is out of 4, still
Uh-huh.
maintaining a full 4.0 GPA.
Okay. So these things are like observership and all this is more like a complementary thing. They are not mandatory, right?
They are not mandatory for American grads, but they are important for foreign grads only because they are the people who will write your letters of recommendation. Letters of recommendation from India don't hold any value whatsoever in your residency application.
Mm-hmm.
All your letters of recommendation have to be from American professors, American doctors.
Okay, okay, got it. So now the candidate has cleared his step one, his or has step one, step two. Now, like
Mhm.
when they can actually expect to, when the matching will start after this procedure,
So, like I said, everything in US begins a year before.
right?
Most American grads only need step 1 and step 2 for application.
Okay.
Foreign grads also need just step 1 and step 2.
Mm-hmm.
But if you just have a step 1 score and a step 2 score, you don't have anything different in your application. You have no research, you have no observerships, you don't have a step 3 score.
Mm-hmm.
Why would somebody take you?
Right.
Right?
Uh-huh.
People won't, like, programs don't take such people. So that's why I applied only after I did my step 3.
Mm-hmm.
I finished all steps. So in my head, what can I bring to the table which is above and beyond a American grad?
Okay.
I will have my step 3. I will have an advanced master's degree. I will have more research. I will have observerships.
Okay.
So
Right.
remembering that you have to be above and beyond any American grad.
So how this third step is different from the rest of the two?
Yeah, so third step is all. Third step is everything. Third step exam is case-based scenarios.
Okay.
So they'll give you an entire case, and
Uh-huh.
then how you will go through the case.
Mm-hmm.
What kind of labs will you order? What kind of imaging will you order? How will you interpret your labs? What is your differential diagnosis? How would you narrow and pass down your diagnoses? What's your assessment of the patient? What's your plan for the patient? It's all a case-based scenario. So every question, which is I think around 120 questions in step 3 when I took it, but it's all case.
Okay. So first two steps are MCQ based and they are like a computer based exam. Yes. And the step three also is like computer based.
Yeah.
but
Yeah,
clinical
yeah,
can,
it's all computer-based exams, but it's just cases, more
the
cases.
cases will be there, right? Right. So, matlab, in advance, like, suppose we have like final year students. So, which documents you would suggest that they should, just take away with them, along with them from their universities?
So ideally, they should take firstly their yearly transcripts. So if you're going in like fourth year, you should have transcripts from first, second, and third year. If you're going in fifth, you should have first, second, third, fourth year, and that like a
Okay.
certificate that you're in good standing at your university and that you're enrolled in the current year.
Mm-hmm.
You can't take a drop year. You have to be enrolled in the current year of your medical school.
Okay. Right. And like everything, your degree, your transcripts, you have to like you have to translate them very from a very authorized organization, and then you need to notarize it, and then you need to apostille them. And for first and second step, your dean must submit your documents. Yes,
Correct.
correct. And for the third step, you yourself can just go ahead with it, because
Upload your
yes, you will be for second
transcript.
step itself. You will be just you need to go to US anyway, if you for the rotation
Yeah,
or the observership and thing, right? Right.
yeah.
So just tell me one thing which most of the FMGs are curious about: is MCI exam is mandatory to just get into USMLE, to
No.
apply for USMLE? No, they can still apply if they
Yeah.
don't have
So
MCI.
USMLE does not consider any other country's licensing. It's not even a category in your application.
But they need to have license in one country. So suppose if they are graduating, for example, from Russia, they need to have a license from Russia, is it?
So that's what I'm trying to say. If you have a medical degree from Russia, then technically you're a doctor in Russia,
Okay.
right?
Technically,
Right.
yes.
So you
Yes.
need to be a graduate of a medical school. You don't need to have a practicing license. In India, if so think of it as this way, if somebody is doing their medical school in India,
Uh-huh.
they graduated from Indian medical school, do they take a licensing exam?
Uh-huh. Got your
No,
point.
right? They don't take any licensing exam
Okay, got your point.
because their degree from a medical school in India is gives them the license to practice in India. Same way, their degree from a medical school in Russia gives them a license to practice in Russia. The
Mhm.
MCI exam is only for people who've worked in any other country and want an Indian license.
Mhm.
That MCI FMG exam has no value in the USMLE market.
Mm-hmm. So that's a good news for some student who are afraid of NCI. But again, take a reality check. एक तरफ कुआं है, दूसरी तरफ खाई है. USMLE is not like, it's not a treat. You have to work hard for it. So, okay, let's take a break for some seconds, and Diksha will continue in a while if it's okay.
Sure. Yeah.
Yeah. Okay. Okay. Thanks a lot. I'll see you in a while. Yeah.